Good afternoon, everyone. Today our topic of discussion is study on incidence of epiphora and lacrimal drainage obstruction in patients receiving docetaxel. No financial interest. Um, so you all know that chemotherapy is a life-saving treatment procedure. Unfortunately, it comes with many adverse effects, some of which are reversible, like hematological toxicities and diarrhea, alopecia, but lacrimal drainage obstruction is obviously an irreversible damage. So patients' acceptability and preparedness as watering as a complication and timely diagnosis and management for the same is of utmost importance. And moreover, there was no previous data on Indian population, which made us curious to take up this study. Docetaxel is an injectable taxane. It hails from taxane group. It's a semi-synthetic analog of paclitaxel and an integral part of modern chemotherapy practice. It is used vastly in breast CA, non-small cell lung CA, head neck CA, prostate CA, GI CA, etc. Among dose-limiting toxicities, there are leukopenia, neutropenia, neurological toxicities, etc. But which makes docetaxel different from others are the idiosyncratic reactions, which are third space fluid retention, nail changes, hypersensitivity reaction, and tearing. Now, tearing from docetaxel is largely painless but may be associated with conjunctival and skin irritation, reduced quality of life, and unfortunately it is underreported by both patients and clinicians. Objectives were to study the incidence of epiphora and lacrimal drainage obstruction with docetaxel in a defined population and to derive any correlation with frequency of dosing and cumulative dose. So ours was a descriptive type of hospital-based observational study which was longitudinal in design. We incorporated total 56 patients who were studied over 1 year period. 26 were receiving weekly regimen of docetaxel and 30 were receiving 3 weekly regimen, and we enumerated them as group 1 and group 2. We included patients receiving docetaxel of more than 18 years of age and willing to give consent for the study, and excluded the patients who had previous history of epiphora or any kind of lacrimal drainage obstruction and had previously received paclitaxel 5-FU or some of its congeners. We evaluated every patient at the commencement of chemotherapy monthly and until 1 month after the last cycle. During each visit, epiphora was assessed and lacrimal drainage apparatus was assessed by probing and irrigation, and we applied standard statistical methods. Coming on to the results and analysis, 13 out of 26 patients in group 1 and 7 out of 30 patients in group 2 developed epiphora, and this association was found to be statistically significant. Same was for lacrimal drainage obstruction. 13 out of 26 in group 1 and 5 out of 30 patients in group 2 developed lacrimal drainage obstruction either in the form of canaliculus stenosis or punctal stenosis, and this association was also found to be statistically significant. So the mean cumulative dose of docetaxel was 576 milligram per meter square in patients who developed epiphora during the study period, and it was 358 milligram per meter square in patients who didn't develop epiphora. And the difference between mean cumulative dose between these two groups were found to be statistically significant. We had total 20 patients presenting with epiphora. Among them, 16 presented with canaliculus stenosis and 2 with punctal stenosis, and the mean cumulative dose of docetaxel was found to be 395, 462 and 525 milligram per meter square at the onset of epiphora, canaliculus stenosis and punctal stenosis respectively. So this gives us a rough idea regarding the safe dose range. When we plotted the cumulative dose of docetaxel at the onset of epiphora in ascending order on the x-axis and number of patients presenting with epiphora for the same cumulative dose on the y-axis, it gave us a linear graph, which means there is increased incidence of epiphora with increase in the cumulative dose of docetaxel irrespective of frequency of dosing. That means the with patients who are more likely to get larger doses of docetaxel, as in metastatic or palliative setting, they are at a higher chance of developing epiphora and LDO, and this was further substantiated by this strong correlation coefficient. And our studies more or less resembled the previous studies that had been taken up elsewhere. So what was new in our study? This is the first Indian and Asian study so far describing docetaxel related ocular side effects, and this incidence was found to be related to both frequency of dosing and cumulative dose received. This was demonstrated by a strong linear relationship, and this made us also curious regarding further studies to be taken up. So to conclude, I can say that docetaxel as a component of several standard chemotherapy regimens causes a significant incidence of epiphora and lacrimal drainage obstruction. Oncologists who are planning to put their patients on docetaxel should explain their patients regarding this possible complication and refer them promptly to ophthalmologists if needed. And ophthalmologists also need to be acquainted with the same, and frequent in-office probing and syringing should be done for timely diagnosis and management. These are my references. Thank you all and welcome to AIOC Kolkata 2021.
Is it reversible or irreversible?
It's irreversible, sir.
Did
We followed up the patients and the patients didn't improve, but I didn't include in my study because the time limit was 1 year only.
No, that is very important, not to say whether it is reversible or irreversible.
I have mentioned it.
If it is irreversible, then what is your message to do? What intervention you would like to do in these cases?
In these patients
because
should
if you know that this is causing this and we cannot do, then there is no point in studying, no?
Yes, sir.
What is the purpose?
So we regarding the management, some medical management.
Preventive management. What is? How can you prevent this occlusion?
There are previous studies which has said there are using of steroid, low dose steroid.
No steroid. You can put a punctum plug, na? Or stent you can put.
Yes, sir.
To prevent this. That is what is written in the articles who devised this thing. Foreign journals mein it is given.
There was also some studies which were postulated that docetaxel causes a generalized mucosal inflammation.
That is correct.
So even punctal plug wouldn't help in that cases.
No, that will not allow it to constrict, na? That will not allow.
Drainage will be prevented in case if you use punctal plug.
You did not use any other objective methods apart from syringing. Did you use any dye disappearance test or something?
No, dye disappearance test, or the best way to use is canalicular endoscopy or dacryocintigraphy, obviously. But because of cost restrictions, we couldn't use any.
Just history from the history of epiphora, that's all.
Yeah, history of epiphora and syringing problem.
No, previous author says you do this thing, anti-segment OCT, you will come to know canaliculus and punctal. There are so many other articles on that anti-segment OCT to say this, the patency of the canaliculus. Okay, thank you.
Thank you.
Very much.